Okay, so in this video, I'm going to talk about Medicare Advantage plans dropping their clients. And as you see on the screen, this is just an article, looks from stateline.org, talking about millions of patients losing their coverage as hospitals drop Medicare Advantage. Not only hospitals, but the Medicare Advantage plans are literally just dropping people from the plan and sending a letter saying you're being dropped as of December 31st, so you need to find another plan. So in this video, I'm going to talk about a couple different things. One of them is going to be about guaranteed issue plans, Medigap plans that you can get on once you're being dropped from your Medicare Advantage plan. The other thing I'm going to talk about is why this is happening. And that's the first thing that I want to talk about because some people want to know that. Why is this happening? Why do I have this letter? And then I'm going to discuss what your options are as far as what you can do, because there's a lot of options. And I've been dealing with this now for a week and a half, whatever it's been, the open enrollment. And this will kind of cover some of the questions that people have been asking me when they call. So first things first, if you've been watching YouTube for a while, or even if you've just gotten on, some of the YouTubers and some of the agents and brokers throughout the entire country that focus on Medicare supplement plans, like I do, have been talking about this for 10, 15 years about how Medicare Advantage plans are something's going to happen. They're zero premium plans. Either the premiums are going to skyrocket or they're going to be dropping people. I know I made a video, I think it was this year, it might have been last year. It was called Medicare Advantage Debt Bomb. It was one of the least watched videos that I've done. And even in YouTube, I have this channel now that I've done for a couple years, but I was on YouTube even 15 years ago. I think 2012, or maybe even 2010 was the first year I got on YouTube. I think it was 2012. But ever since then, especially from 2015 on, after we had that 2008 crisis, what happened was for 2 years, everyone jumped off of their Medicare Advantage plan because the premiums rose. I talk about this in my videos all the time. So 2009, 2010, 2011, brokers like myself, agents, were running around. We used to go to the house back then. We were switching people from Medicare Advantage onto Medigap plans. I mean, one after another. And it was because of that financial crisis. All of a sudden in 2012, I think it was, the Advantage plan started to bring back those zero premium plans. And it was slow. It started with one company, then the next year it was another one, and then after that. And they still had problems. But by the time 2018 rolled around, it seemed like every company had a zero premium Medicare Advantage plan. They were getting subsidies from the government, and they were giving their clients everything, as far even gas cards and gym memberships and all this free stuff. The over-the-counter cards that most of them have. So what went wrong? Well, as I talked in that video, the debt bomb, we saw this coming. The government doesn't have the money to just keep throwing the subsidies at these Medicare Advantage plans. That's number one. Number two, zero premium, and people were getting on these plans, and we saw it, they were getting denied certain coverages. Oh, you need a knee surgery? Well, we want to see that you went to physical therapy for 3 months or whatever it was. I was getting phone calls like that. Plus, the networks were getting tighter. I wanted to go to this hospital 2 years ago. It was accepted. Now the hospital doesn't accept my Medicare Advantage plan. I need to get on another one. It's finally in 2025, the debt bomb is here. Number one, the money is being lost. There's actual lawsuits from hospitals. I talked to a gentleman over the phone who's now my client, who said he works at a hospital, let's just say, and they had told him that Medicare Advantage plans owed them $8 million, and they just decided not to pay them. And so they have to sue the Medicare Advantage plans. This stuff is happening all over the place. A lot of people called it. There's some great YouTubers that I've seen and I've watched, and some of them I've talked to that have been calling this forever, even longer than I have. And when you've watched so many years of all these people jumping in for freebies and I get this and it's so great, all of a sudden 2025, the chickens are coming home to roost or whatever it is. Basically, the Advantage plans are now starting to drop people, and it just started from what I see this year. In the future, it's going to keep happening as far as I'm concerned. Maybe not. Maybe we have like a little wave, debt wave. But if the economy keeps going the way that it is, this is what's going to happen far into the future. What can you do about it? So when you get that letter, basically you're able to get on another Advantage plan or another Medigap plan. Now, my office, we are only going to take people that are guaranteed issue if they're unhealthy, for the most part, and they're not going to be able to pass underwriting. We're going to take them from these states, and I'm going to name the states: Colorado, Florida, Idaho, Indiana, Massachusetts, Minnesota, Montana, New York, Oregon, South Carolina, Tennessee, Vermont, and Wisconsin. These are the states that it doesn't matter how sick you are. It doesn't matter what treatments you're getting. If you got one of these letters, you can call us and we're able to switch you for a Medigap plan. Now, if you're not in one of these states and you actually don't take a lot of medications, or you're in good health, you take one blood pressure medication. But if you want to go through with that letter, we're not going to be able to help you. But if you want to go through underwriting, it's not that big of a deal. That's another thing. But those states, if you're from those states and you got a letter, it doesn't matter who that letter's from, give us a call and we can help you. But the thing is, I've seen in certain states like Oregon and different places, a lot of these companies are saying, forget it. There's too much. They're losing money. I know why. Look at some of the states where they have a homeless problem, or, I mean, it's basically like everyone's getting freebies. This is just another thing that the government has to give handouts to these Medicare Advantage plans, and now they can't afford it. For a long time, they said, oh, we're getting subsidies. This is great. You know, we have this Medicare Advantage plan. We're making money. They're no longer making money. But that's what you can do about it. You can go into another Medicare Advantage. You can go into a Medigap plan. But keep in mind, not a lot of brokers are going to work with you because the paperwork is a lot of work. And you need to start doing this sooner than later. On your letter, it's going to say you have until December 31st. Do not call brokers and agents in December, whatever it is, December 6th, and say, I want to do this. Because a lot of them are going to think to themselves, oh, this is a lot of paperwork. And if it goes wrong, I'm going to have to deal with this person. And to be honest with you, the commissions are so bad on this, a lot of people might turn you down. So I wouldn't wait on it if you could. I hope this video helps. It was kind of short. Most of my videos don't discuss this type of thing. But if you got a letter from Humana or United Healthcare or Aetna or any of these companies in any of these states, give us a call and we'll help you out. Thanks for watching the video. I'll see you at the next one.